So body dysmorphic disorder, which was formerly known as dysmorphophobia, is listed under the section Obsessive Compulsive and Related Disorders in the DSM-5. It's estimated that around 2.4% of those in the United States have this disorder, and the vast majority of cases start to begin during the teenage years, with more than 2/3 of cases presenting before the age of 18 years old. When you look at the rates across various medical specialties, it's estimated that 9 to 15% of dermatology patients, 7 to 8% of cosmetic patients, 8% of adult orthodontia patients, and 10% of those presenting for oral or maxillofacial surgery will have this disorder. So when evaluating for body dysmorphic disorder, there are 4 criteria that we psychiatrists take into consideration, and these are listed from A to D in the DSM-5. Criterion A states that there's preoccupation with one or more perceived deficits or flaws in physical appearance that are not observable or appear only slight to others. Concerns can focus on one or many body areas, with the most common ones being one's skin, hair, and nose. So in the office, we will hear about perceived acne, scars, wrinkles, thinning of hair, excessive body or facial hair, or misshaped noses. Patients will believe their flaws look ugly, unattractive, abnormal, or deformed. And a lot of people become preoccupied about asymmetry, and they'll have intrusive, unwanted, time-consuming thoughts that are difficult to resist or control, and these can last up to 3 to 8 hours per day. Criterion B notes that at some point during the course of the disorder, the individual has performed repetitive behaviors or mental acts, and this can include things such as comparing one's appearance with that of others, repeatedly checking perceived deficits in mirrors or other reflective surfaces, seeking reassurance from others about how the perceived flaws look, excessively exercising or weightlifting, seeking out cosmetic procedures, or excessively grooming, whether it's combing, styling, shaving, plucking, or pulling hair. And oftentimes, these activities are not pleasurable, and they actually increase one's anxiety. Criterion C states that preoccupation causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. Lastly, Criterion D says that the appearance preoccupation is not better explained by concerns with body fat or weight in an individual whose symptoms meet criteria for a disorder. Whenever I make the diagnosis of body dysmorphic disorder, I will always also screen for major depressive disorder, as this is the most common comorbid disorder and often presents after the onset of body dysmorphic disorder. But most importantly, I will always make sure to do a good, thorough suicide risk assessment, as the rates of suicidal ideation and suicide attempts are high in both adults and kids with this disorder. If you have concerns that you or your child are struggling with these various signs and symptoms, please do not hesitate to reach out and make an appointment with your primary care physician or psychiatrist to get further evaluated. Now head on over to the next video to find out more ways that you can live your best life.